Welcome back. This is the last segment of the lecture. And in this segment, we'll look at benefits, the drawback, and we'll draw some conclusions. So, welcome. So, what benefits does GIS bring into health applications? One of the most important aspects is the efficiency in data collection. We have mobile apps, we have mobile solutions that has been developed to use in collecting field data that can be deployed in health related studies and application as well. So efficiency is brought into data collection. These ultimately reduce risk of human error because the data collection platforms and architecture can be designed in such a way that errors can be reduced to the bare minimum. Uh, the other aspect is that there's a whole range of a very wide range of dimensions that are being brought into health data. For example, if I collect data about health outcomes at maybe at the ward level or at the local government level, I can relate that to the amount of vegetation in certain places, the level of urbanization in the place, the level of the amount of rainfall, the average temperature, relative humidity, uh, average amount of pollutants, certain pollutants in the air, and so on. So a whole range of dimensions, wide numbers, a huge number of dimensions can be brought into health data by using GIS within health application. And this ultimately brings new insight and new perspective to old problems. Well, human beings have always been interested in how diseases are spread and where can you find it and why is it happening here and why not in certain places. So by extending GIS to health application, this can be uh, a very important benefit. The other aspect is solution finding, whereby application of GIS brings new solutions, for example, cost effectiveness, optimization, with efficient resource allocation and things like that can be added to health application by incorporating GIS. So, what are the drawbacks? Without huge database, don't get me wrong in terms of saying huge now. I don't mean you have to have terabytes upon terabytes of data, but at least the data must be substantial enough and the quality must be good enough for you to start having a reliable GIS system that can actually help you solve a problem. So GIS is data quality and data quality dependent. If you have just a data set of just three local governments or one local government as a point, and you say you are requesting for analysis of one point, you are not going to get anything out of that. So we need data that is big enough to lend itself to proper analysis. Ethical issue of confidentiality is a very important thing because since the data is spatially referenced, means it becomes possible for people to find whomever you're referring to. So I'll give you a very simple example. If you have carried out a survey in a local government, or let's say a village that is made up of maybe about 50 or 60 people, and you found out that about 10 of them have maybe HIV or cancer or particular ailment, and you have georeferenced their household, the location of their household, okay? If you prepare a map and you plot that, it becomes easy for somebody to say, oh, that is the house of the person that has so ailment. So confidentiality is an issue that needs to be addressed whenever you're working with data that are specially referenced, which may be traced back to whomever the data, the attribute belongs to. So you need to be very careful and take this into cognizance when you are processing the data and when you are providing it out, when you are producing your output for other people to consume. So this becomes very challenging when you have small population, as I've highlighted, but there are ways to go about it. But you have to take note of this. You have to take this into cognizance. This brings us to the end. Application of GIS in health-related studies will continue to grow, and as improvement and development in GIS techniques and technology continue to grow, the application will also continue to blossom. There will be new areas, there will be new ideas. It's the way the human uh, mind works. We always develop, we always improve. Another aspect is the spatial decision support system is the way to go. And COVID-19 has actually shown that this is very important. Spatial decision support system have been used in knowing start where to start the vaccine deployment, the vaccination process, or programs, how to go about implementing lockdown, where is the disease going up, where should we have a restriction, what should we limit, and so on. So incorporating that spatial component into decision support system has been a revelation. It's not something new. It has been in healthcare and public health for a long time, but a lot of countries, a lot of areas, people and actors became uh, aware and got sensitized to its usefulness during this pandemic. GIS is an essential tool for public health, epidemiology, health informatics, health geography. So that essentiality is never going to go away. It's going to get better. And you are lucky you're studying medical geography and now you have exposure to what GIS can do. So your imagination is the limit. Disease, illness, and ailment has spatial dimension. So, as long as that spatial dimension is not going to go anywhere, it's not even a question of as long. It's not going to go anywhere. So, GIS will be very vital in providing new insight. So, I hope that I've done justice to what I propose that I'm going to do at the beginning. And if this stimulates your curiosity, I will provide also some of the references to some of the literature cited in this work. I will enjoy you to read up on some of them. And also, hopefully, this should also stimulate more collaboration across the university, and thinking about health and well-being of the people is not something that is done only by people in geography. It spills across different areas, and I hope that you will also consider working with other people across different fields to ensure that we have uh, a better, healthier, and well developed human capacity in the country. Good luck, and thank you for the opportunity to tell you this story today. Enjoy the rest of the day. Bye bye.